Go ahead and take a deep breath. Another deep breath. Another one. Let me know if you feel dizzy at any point, okay? Take a deep breath. Okay, I'm gonna go up here a little bit. Deep breath. Okay, deep breath. One deep breath over here. And over here. Okay, now I'm gonna listen on both of your sides. So I'm gonna go ahead and have you take a deep breath for me. Okay, another one. Okay, one more. Okay, we're gonna move to this side. Deep breath for me. Another deep breath. And one more. Good. Okay, I'm gonna spin you around again. I'm just gonna take a listen at your back, okay?
Okay.
Just take a deep breath for me. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, another deep breath. Another deep breath. Okay, one last one over here. And one more for me. Perfect. Okay. Heart or lung sounds were good. I didn't notice any abnormal breathing or anything. They sounded nice and clear. So next we're gonna go ahead and listen to your heart. So we're gonna start. We're gonna listen to your aortic. Sounds good. Next, we're gonna move to your pulmononic. Okay, now we're gonna move to your Erb's point. Thirteen, 14. Okay, next we're gonna move to your tricuspid. We're just gonna listen to those valves, okay? So, sorry. I'm actually gonna just kind of go right under here, okay?
Yeah.
Okay, next we're gonna listen to your mitral right down here, okay? Actually, we're gonna move right there. Okay, heart sounds were I didn't hear any wheezes or murmurs. All heartbeats were lub-dub, lub-dub, lub-dub. Go. Next, I'm gonna go ahead and listen to your carotid artery. Okay, I'm gonna go ahead and do the other side. Okay, I did not hear any bruits or whooshings. Next, we're gonna go ahead and I'm going to feel your pulses. So we're gonna start with your carotid, but I will not occlude both sides because it will cause you to pass out. Okay, I'm gonna perform it on this other side. Okay, very good bounding pulse. I'm gonna feel for your brachial. Bounding and strong on those as well bilaterally. I'm gonna feel your radial. Those are strong and equal bounding bilaterally as well. So I'm gonna just place my hands right here to feel your femoral. Okay, I know it's gonna tickle. I'm sorry. Now we're gonna go ahead and listen to your heart. So is it all right if we pull up your shirt?
Sure.
Okay. So we are going to listen aortic, pulmonic, Erb's point, tricuspid, and mitral. And then we're going to switch it to the bell and do aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. Now if you will stand up for me, I'm going to palpate your spine. So if you'll just turn this way, we're gonna lift your shirt up. All right, will you bend over just a little bit for me? All right, it looks like her spine is midline. All right, and under your shirt, we're just gonna go ahead and do your rise and fall of your chest. So will you breathe in for me? All right, if you'll turn this way, we're gonna do the front. Will you just breathe in for me? Okay, perfect. And while you're here, we're just gonna go ahead and do, if you will say 99 for me.
99.
All right, and turn around. We're gonna do the same on the back. You say 99 for me.
99.
And one more time.
99.
All right, her symmetry is good. Now we're gonna go ahead, we're gonna listen to the front of you. We're gonna listen to your lungs. All right, so there are 10 spots to listen to on the front. All right, is that all right if we lift your shirt up one more time? Okay. All right, and then we're gonna go ahead and do the back. And there are 18 spots on the back.
Okay, that's good. You can go ahead and put your shirt down.
And now we're gonna start looking at your chest so you can face me. And first we're gonna listen to your lungs to make sure that they're clear. When I was counting your respirations, I didn't see any retractions or heaves, and you looked like you were breathing with ease, but we just want to make sure that your lungs are clear. So you can take deep breaths and clean my stethoscope. Good, your front sounds clear. I'm gonna do your back. You can hug yourself. Do 6 more deep breaths. Good. So your lungs sound clear. I don't see any use of accessory muscles. And now we're going to listen to your heart. So first I'm going to start by finding your sternal angle, which would line up with your second intercostal. So right here should be your aortic. And across from that second pulmonic. And the second. Then to the third Herb's point. Fourth intercostal, tricuspid. And last is mitral, and fifth intercostal space. Good. So I hear both
Here, I'm going to have you press up on my shoulders. All right, and now I am going to auscultate to listen for any type of bruise. I'm going to auscultate with my bell. I'm going to auscultate at the base of the jaw, and mid-cervical, and the base of the neck. And on the other side. At the base of the jaw, mid-cervical, and the base of the neck. And there is no bruise noted there. All right. Now I am going to move to the back, okay? Okay. All right. Her spine is straight and midline. And there's no tenderness upon palpation. Her ribs are downward sloping. And I'm going to assess for symmetric expansion. Can you take a deep breath? And I'm assessing at T9, around T9, T10. And there was bilateral symmetric expansion there. I'm going to auscultate, or I actually am going to palpate first. This is tactile fronitus. I'm going to have you say the words 99.
99.
Again.
99.
Again.
99.
One more.
99.
And one more.
99.
All right. Tactile fronitus is intact. All right. Now I'm going to auscultate the 9 pairs of lung fields, okay? Okay. I'm going to ask you, I'm going to auscultate for 1 full inspiration and expiration. So a deep breath in and a deep breath out, okay? Okay. All right. I'm assessing with my diaphragm. Can you take a deep breath?
Yeah. I did. Yeah. And then when I did it here.
So you got 30, you got 40 already.
Okay. Well, then when I did this, I didn't know if I was supposed to do nursing intervention for each of my outcomes that I stated.
Only your number 1.
So I just did it.
What?
So I only
No, you're right. It's top 3 for all.
Yeah, so you do 3
Who knows? I
outcomes.
need to find that out. I don't want to do all
One more. And last one. Alright. Bilateral breath sounds are intact. No adventitious sounds noted. Breath sounds are clear bilaterally in all fields. Alright, can you tell me those 4 words again?
Kitchen, dog, village yellow.
Alright. Now I'm going to assess your anterior chest. Your respirations are 17. As they were earlier, they're non-labored. And now I am going to listen to your lung sounds, okay? There's 5 pairs of lung sounds for the anterior chest.
What are we going to do to eliminate or reduce the problem and eventually the expected outcomes must be remembered today. Go grab it, you got 2 to 3 hours. No, seriously. She'll let you do it. Why don't you go grab it and we'll work on it. You don't need anything to
Alrighty. Bilateral breath sounds are clear, and there's no adventitious sounds noted. Alright, I'm going to assess your skin turgor here. Skin turgor is intact, there is no tenting. I'm going to assess your upper extremities. The skin tone's even on bilateral sides. There's no edema noted. Temperature is warm and dry. And now I'm going to have you lay on your back, okay?
Okay.
Alright, can you look to the left for me? Alright, so the jugular vein is present. And now I'm going to raise you up to 45 degrees. And the jugular vein should disappear.
I would agree. We got 4 hours. We got it. We got it.
Alright. Jugular vein is gone, so there is no jugular vein distension present. Alright, now I'm going to lower you back down to about 30 degrees. Alrighty. And now I'm going to assess your heart, okay?
Okay.
Alright, so there's no heave or lift present. I'm going to help you for your apical impulse, okay?
Okay.
And that is around the 5th intercostal space. And she's a rare occasion. Hers is palpable. And that is typical in those that are of the skinnier type. Alright, now I'm going to auscultate for 1 full minute for rate and rhythm at the apical pulse, okay?
Okay.
You mean tell you to do it? Or you mean to like help you, indicate to do it? I think she's gonna be upset if she's not. I think it's like there's 100 people recording stuff. And I refuse to believe that all of the patients didn't accidentally indicate what they're doing. Like when you're doing this figure sense stuff, like, you know, like, or like when you're doing the strength.
The rate is 68. It is a regular rate and rhythm. Okay?
Okay.
And now I'm going to listen again.
As long as she's not reading you,
I'm going to listen at the 5 points with my diaphragm. So I'm going to listen.
she's a totally reasonable chick.
It's in a Z pattern, okay?
Okay.
So I'm listening at the aortic, the pulmonic,
Okay. So you got 2 off here. One up here.
Erb's point, mitral, and tricuspid. And now I'm going to listen with my bell to listen for a murmur. And that's again at aortic, pulmonic, Erb's point, mitral,
Potentially 7.
and tricuspid.
Potentially
And just visually inspect your thoracic area. Is it okay if I move your shirt around?
Yeah.
Okay. And here I'm just really looking at the musculoskeletal structure and the skin and making sure there are no abnormalities. Are you comfortable?
Yep.
All right. Alrighty, so AP ratio is 1 to 2. It appears there's an ease of movement while she's breathing. The skin itself, it is It is warm, smooth, dry, and intact. There is even color throughout. Musculoskeletal structure, bilaterally symmetrical, no signs of deformities. Okay, now I'm gonna go ahead and pinch you. This is just to check for hydration.
Okay.
All right, so for skin trigger, there are no signs of dehydration. All right, now I'm gonna go ahead and listen to your heart.
Okay.
I'm gonna listen for 1 full minute, and we're gonna listen at the herbs point. Alrighty, so heart rate at the herbs point is 68 beats per minute. Alrighty, now I'm gonna go ahead and listen to some lung sounds. Is it okay if I go under your shirt?
Yeah.
Okay. Alright, I'm gonna start by listening to the anterior bronchovesicular spaces. Breathe in. Breathe in. All right, now I'm gonna go a little lower. Okay? Breathe in. And breathe in. All right, now I'm gonna listen to the anterior vesicular breath sounds. All right, breathe in. 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 And breathe in. Okay. Anterior bronchovesicular and anterior vesicular breath sounds are clear and equal bilaterally. All right, so if you could turn around, we're going to go ahead and listen to the posterior breath sounds. Okay. Alrighty, so I'm going to start with the posterior bronchovesicular breath sounds. And I will find those between the spinal column and the scapula. All right, breathe in. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. Okay, and now we're going to listen to the posterior vesicular breath sounds. Breathe in. 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 And breathe in. Alrighty, all breath sounds are
Your lungs here. So starting with the posterior, her spinous process is straight. The posterior thorax is equal. There's no pulsations. So every time I place the stethoscope, take a deep breath in and out for me through your mouth. Alright, now I'm going to have you lift this arm for me. Thank you. And awesome, thank you. And now we're moving to the anterior chest. It is symmetrical. The rising of the chest is equal, and there's no pulsations. Her A&P ratio is 1 to 2. Right. Again, breathing in and out through your mouth for me each time I place it. Thank you. Are you having any trouble breathing or shortness of breath?
no.
Okay, I'm now going to listen to your heart. So just breathe normally. So the right second intercostal space is the aortic. The left second intercostal space is the pulmonic. The third intercostal space is Erb's point. The fourth intercostal space is the tricuspid. If you wouldn't mind lifting for me, thank you. And the fifth intercostal space is the mitral and apical pulse, and I would listen here for a full minute. And I'm now going to listen in the same spots with the bell of the stethoscope. Again, the right second intercostal space is the aortic. The left second intercostal space is the pulmonic. The third intercostal space is Erb's point. The fourth intercostal space is the tricuspid. You can lift for me again, thank you. And the fifth intercostal space is the mitral and the apical pulse. And again, I would listen here for a full minute. Thank you.